Hello everyone and welcome to Defense Shows. I Kiran dealing with health and diseases condition. In yesterday class we did communicable diseases and dietary deficiency diseases and genetic diseases too. Now we will deal with viral diseases. Let's see what are these. Firstly, before moving toward it, let's see again what are the kinds of diseases. These are communicable diseases, viral diseases, helminthic diseases, protozoans diseases, fungal diseases, non-communicable diseases, dietary deficiency diseases, and genetic diseases. Yesterday we did communicable diseases, dietary diseases, and genetic diseases. If you haven't seen that video, please do visit there and clear your concept regarding the communicable, dietary, and genetic diseases. Now let's move to what's the viral diseases. See friends, there are different type of the viral diseases. Some of these are measles, mumps, smallpox, chickenpox, polio, is also known as infantile paralysis, okay, influenza also known as flu, rabies, hydrophobia, dengue fever, hepatitis, AIDS, yellow fever, swine flu, and coronavirus. Okay, so let's see what does viral disease tells us. It is a viral disease which a viral disease is any type of the condition that caused by a virus. Simple. Okay, it is a viral disease is a condition, any type of the condition that is caused by a virus. Okay, now let's see measles. In Hindi we call it khasra. Okay, measles is caused by rubella virus. See friend, when I say rubella, so it means measles. Okay, it means measles, but when I say rubella, okay, so it means German measles. Okay, German measles. This is the basic concept and frequently asked question in the competitive examination, one liner question. Okay, so it is caused by rubella virus. Measles is caused by rubella virus and German measles is caused by rubella virus. Okay, it is transmitted by contacts, fomites, or droplet method. See friend, measles is transmitted by contacts, fomites, and droplet methods. So what is fomites? Fomites is any object or material which are likely to carry infection. Okay, which are likely to carry infection, such as clothes, utensil, and anything. Okay, and many more. Let's see, it enters through the respiratory tract. Okay, the virus attack through the respiratory tract and the eyes. Okay, then it is characterized by itching, skin rash, small raised red spot. Okay, this is very important. See, it is characterized by itching, skin rash, small raised red spot starting from the back of the ear. See friends, it the rest will start from the back of the ears and will reach to the forehead, face, and then on the whole body. Okay, then what is the vaccination of measles? It is MMR. What is it? It is mumps, measles, and rubella. Okay, is given at the age of 1. Now see, mumps. Mumps is caused by paramyxovirus. It is transmitted by direct contact, droplets, and fomites. Okay. Patient feel difficulty in what? In swallowing and opening of the mouth. Okay. Now see, symptoms are high fever, chills, headache, general body aches, and loss of appetite are the symptoms of mumps. It is treated by vaccine, measles, mumps, and rubella. Okay. Next one is smallpox. See friend, smallpox is known as chechak in Hindi. It is caused by virola virus. Okay, variola virus, and the symptoms are reddish spots, which is changed into papules firstly, then pustule, and then finally scab. Okay, these are the condition of rash. Firstly, the spots will change into papules, then pustules, and finally scab. Now see, spots appear firstly the smallpox के जो स्पॉट्स होते हैं वो फेस में अपियर होंगे, देन फॉलोड बाय ओवर रेस्ट ऑफ द बॉडी एंड बट फ्यूअर इन द ट्रंक. सो फर्स्टली विच द क्वेश्चन दैट अराइजेस दैट कि स्मॉल पॉक्स के जो फर्स्टली रेसेस होते हैं और स्पॉट्स होते हैं वो कहाँ पहले दिखते हैं, तो वो पहले कहाँ दिखते हैं? फेस में दिखते हैं, राइट. सो व्हाट इज़ द वैक्सीनेशन? of the smallpox, vaccination through the smallpox vaccine, simple one, which is developed by, see friend, Edward Jenner is the great and scientist who discovered the vaccination of the smallpox. Okay, this time smallpox is eradicated enough from our country. Okay, now see, chickenpox. Chickenpox is caused by varicella zoster. Okay, it is caused by varicella zoster. Basically occur in the winter and springs. Races first appear on, see friend, इसमें trunk में पहले, इस chickenpox में trunk में पहले races होते हैं और smallpox में face में पहले races थे. ठीक है, ये basic difference है. Followed by forehead and face. Last में किस में होता है? Face में होता है. जो scab फॉल होते हैं विदाउट लिविंग एनी मार्क, कोई मार्क नहीं रहता है. ओके, एंड नो वैक्सीन, ओनली यूज ऑफ बोरिक एसिड. वाई? बिकॉज द माइल्ड एंटीसेप्टिक प्रॉपर्टी इज देयर ऑफ बोरिक एसिड. ओके, नाउ सी, पोलियो एंड इन्फेंटाइल paralysis, it is also eradicated from our country in 2014. Okay, so it is a preventive diseases caused by the polio virus or enterovirus. Okay, infectious disease, infant and children. It produce, see friend, it produce inflammation of nerve. I told you in my previous lecture that it is a disease of central nervous system. Okay, that's why paralysis is happening. It produce inflammation of nervous system causing inability to bend the head forward. Right, inability to bend the head forward. Polio is preventive. Okay, we can prevent it. See friend, there are two vaccine. It is Salk and Sabin. Okay, these are the two type of the vaccine. So Salk vaccine is available for taking at the age of 6 weeks. See friends, very important, 6 weeks, 10 weeks, 14 weeks, and the booster dose at the 18 to 24 months. Okay, Salk and Sabin. Sabin is also there. Okay, these are the two type of the vaccine we can give in the polio. Let's see, next one is rabies. I told you hydrophobia. Okay, I told you hydrophobia, the fear of water. Okay, let's see, it is caused by rhabdovirus. It is caused by the rhabdovirus, transmitted to human beings by biting saliva of rabbit. यहाँ rabbit मतलब क्या है? Mad. Okay, rabbit means क्या है? Mad dog or cat or etc. और भी animals हो सकते हैं. Okay, fear of water is the most important characteristics. That's why I called it hydrophobia. The virus destroyed the brain and spinal cord. Okay, antibody form there. Okay, brain and spinal cord को क्या करते हैं? Destroy हो जाते हैं. 6 doses of vaccine are recommended in the rabies condition. Now see, dengue fever. It is caused by Dan-14 virus, and the mostly asked question in exam, it is the Aedes aegypti. Okay, it is caused by Aedes aegypti, which is a female mosquito. Right, blood platelets number fall below 70,000 per cubic millimeter. Okay, now symptoms are headache, fever, chill, pain in joint and skin rashes are the feature and symptoms of dengue fever. See friend, पेन में जॉइंट होना, स्किन में रैसेस होना, हेडेक, फीवर एंड चिल्स आर दी symptoms of dengue fever. I think it's clear. Now AIDS. The full form of AIDS is acquired immunodeficiency syndrome. Is a disease of human immune system. इसमें क्या होता है? सिंपली जो हमारा इम्यूनिटी होती है, इम्यून सिस्टम होता है, टी लिम्फोसाइट, बी लिम्फोसाइट होते हैं, वो क्या हो जाते हैं? कम होना स्टार्ट हो जाता है. दैट्स वाई आई कॉल्ड यू कि अगर किसी को एड्स है तो उसको अपॉर्चुनिटिक इन्फेक्शन हो सकता है किसका? ट्यूबरक्लोसिस का, क्योंकि इसमें क्या हो रही है? इम्यूनिटी डिक्रीज हो रही है, तो दूसरे डिजीज़ कैच करने की पावर क्या हो जाती है? इंक्रीज़ हो जाती है. ऑल्दो बॉडी की पावर कम हो जाती है, लेकिन और इन्फेक्शन होना ईजी हो जाता है. राइट, देन इट इज़ कॉज्ड बाय ह्यूमन इम्यूनोडेफिशिएंसी वायरस. आई टोल्ड यू यस्टरडे. सिम्टम्स लॉस ऑफ वेट, प्रोलॉन्ग फीवर, chronic डायरिया, फटीग. See friends, really important. Okay, then what are the diagnostic tests? It is ELISA. Okay, enzyme linked immunosorbent assay, PCR. Okay, are the confirmatory test. So what are the confirmatory tests of AIDS? These are ELISA and polymer chain reaction are the confirmatory test of AIDS. See friend, it has in the intracellular distribution. No, it is nothing. Then swine flu. Swine flu, it is caused by H1N1 virus. See friend, what is H1N1 virus? It is hemagglutinin and neuraminidase, right? It is hemagglutinin and neuraminidase. It is also known as hog flu and pig influenza. It is also known as hog flu and pig influenza. What are the vaccine we use in the swine flu? It is Tamiflu and Relenja vaccine are used to prevent the swine flu. What are the vaccine? These are Tamiflu and Relenja vaccine. Okay. So next one is coronavirus. The shape of corona spikes होती हैं इसमें, ठीक है? That's why it is known as coronavirus. Okay, so it is an infectious diseases, COVID-19. Coronavirus discovered in 19, right? We can say that caused by the newly discovered coronavirus. It is spread throughout droplets of saliva and discharged from the nose when an infected person cough and sneeze. That's why we say that we must know the etiquettes of coughing. Okay, how we have to cough, it's really important, otherwise we can spread the infection to other person. So this is all for today. We have completed this viral topic, and in tomorrow classes we will see helminths diseases and many more. See friends, now there are some questions for you. Let's solve them. Most effective medicine for malaria is, see friend, whenever the medicine of malaria you may ask from the examiner, it is very simple. It is quinine, right? It is quinine. See next, which one is a viral disease? Okay, cholera, rabies, tetanus, none of these. See friend, I told you what in this class about the virus diseases. So what would be the viral disease? Rabies. Because cholera, tetanus, I told you in my previous lecture of the communicable diseases, right? तो rabies is the correct answer. Hydrophobia भी होता है जिसमें, ठीक है? Hydrophobia भी होता है, right? Then next one is, which disease is called as royal diseases? I told you in my previous lecture, like रॉयल डिजीज़ हीमोफीलिया को बोलते हैं, बिकॉज क्वीन विक्टोरिया को भी की फैमिली को भी हुआ था, राइट? सो देयर आर सम क्लॉटिंग फैक्टर 8 में प्रॉब्लम हो जाती है, दैट्स वाई हीमोफीलिया का कंडीशन आता है, राइट? क्लॉटिंग अच्छे से नहीं हो पाती है. सो किस कंडीशन में? हीमोफीलिया में, राइट? सो नेक्स्ट वन इज ब्लैक डेथ इज द नेम गिवन टू प्लैग. आई टोल्ड यू हेमरेज होता है फर्स्टली तो रेड कलर का होता है, बट बाय passing of the time it become black, that's why it known as black death. Okay, so next question is, which one of the following is a genetic disorder? Options are bronchitis, night blindness, osteoporosis, sickle cell anemia. See friend, what is the correct answer of this? What I told you in my previous classes about sickle cell anemia, it is a genetic disorder, because night blindness is the vitamin A deficiency. Okay, bronchitis and osteoporosis are also different, so correct answer will be sickle cell anemia. So next question is, which one of is the causative agent of cerebral malaria? See friend, this we will discuss in our further classes about the malaria. There is one species called Plasmodium falciparum, which is the agent of cerebral malaria. Okay, it is cerebral malaria, right? Which one of the following is not a bacterium? Options are Escherichia coli, Treponema pallidum, Neisseria gonorrhoeae, Wisheria bancrofti. See friend, I told you about the Escherichia coli. Okay, it's a bacteria. Neisseria gonorrhoeae we saw in our previous classes. It's a bacteria. Treponema pallidum syphilis होता है जिससे, ये भी बैक्टीरिया है. Then Wisheria bancrofti comes under elephantiasis, that's why it is not in bacterial disease, it is a filariasis disease. Now next question is match list. This is a very common question of CDS. Okay, means match the following types. So see friends, what would be the correct answer? Common cold किससे होता है? See, common cold किससे होता है? Let's find out. Common cold is by rhinovirus. Okay, so food poisoning is by Clostridium botulinum. Okay, the next one is whooping cough is by Haemophilus pertussis. Okay, थर्ड का ये हो जाएगा. सेप्टिक सोर थ्रोट इस, जहाँ भी सेप्टिक जैसा कुछ आएगा ना, वो स्ट्रेप्टोकोकस से होता है, ठीक है? सो ए का 2, बी का 4, C 1 and D 3. Okay, this we have done. Now let's see few more question. Rat are known to transmit the germs for. Simple one, It cause for plague. Next one is infection of tetanus usually occur by, a simple question, okay, is occur by roughly cooked food. Okay, the food is not cooked properly and it may cause tetanus. We will read this in our further classes. Polio vaccine was first discovered by Salk. I told you about Sabin and Salk. Salk, right? So it was discovered by Salk. Important question. Now next one is the disease hemophilia in human being is due to X linked recessive gene. Okay, consider the following statement regarding human nutrition. Iodine deficiency can cause mental disability. No, it causes hypothyroidism. It causes hypothyroidism. Okay, next is retinol deficiency lead to the defective tooth formation. No, it causes, it is due to the vitamin a deficiency and it causes night blindness. Okay, it causes night blindness. Next one is thiamine deficiency leads to waterlogging of the body tissue. No, it is the B1 deficiency. Thiamine is the B1 deficiency. Berry, right? Berry. Now next one is niacin deficiency causes plague. Yeah, it is the correct option. So only fourth will be right one. Okay, see friends, niacin D3, dementia, diarrhea, okay, are the causes of the niacin. So we have done this question too. Thank you. Keep learning. If you like this session, don't forget to like it, share it and subscribe our channel for more updates. If you don't know that we have live classes too of maths at 6 p.m. and of SSB at 8 p.m. Do visit there. Keep learning. Thank you.